Hi, I'm Mayor Tim Balderman. I'd like to welcome you to this edition of Community Business Spotlight. Joining me today is James Randolph from Randolph Sports Physical Therapy. How you doing?
Good, thank you very much.
Good, thanks for being here.
Thank you.
All right, tell me a little bit about your business.
Okay. Well, first off, I want to thank the Village of New Lenox and yourself for allowing me the opportunity to spotlight my business here on Channel 6.
Sure.
So I'm the owner of Randolph Sports Physical Therapy. We are an outpatient physical therapy facility located here in New Lenox. I specialize in the evaluation and rehabilitation of a variety of different diagnoses, injuries, physical ailments that individuals may be suffering from. That could include low back pain, injuries sustained at work, motor vehicle accident associated injuries, individuals who suffer from chronic conditions of osteoarthritis. And we also offer vestibular rehabilitation as well for people who may have dizziness or balance disorders. Personally, I hold a special interest in treatment of spinal disorders.
Okay.
So disc herniations, spinal stenosis, muscular strains, sciatica, and then can offer individuals a variety of different treatment options based on each individual's needs.
Okay, so you're here in New Lenox, and where exactly are you located? We
are located at 1316 Cedar Road in the Village Square Shopping Center, which is on the corner of Cedar and Francis Road. And I always say we're a couple doors down from the CP Meat Market and Little Joe's Pizza, because those are well-established landmarks in New Lenox, and everyone seems to know where they are.
They are.
We're next to CP. So.
No doubt about it, no doubt. And how long have you been there? I remember being at your ribbon cutting. That was...
Yeah, I officially opened my doors on September 3rd of 2009, so I've been there for just over 5 months. I've been doing outpatient physical therapy services for a little over 9 years, doing direct patient care, and decided to venture off and do my own thing. It's been an exciting adventure so far.
Now, you find a lot of people are in physical therapy, like you said, either for an accident that occurred at work, or do you see people that come to you first and you need to refer them other places, or maybe there's other options first, or is physical therapy a first option?
Absolutely. In fact, there are a lot of physical therapy clinics that are opening up around. It's a very common practice, and one of the reasons is in the last couple years, 10, 15 years, again and again, physical therapy is being shown to be a very practical alternative to surgical interventions. If individuals are on pain medications, help manage their pain, physical therapy may provide an alternative to wean them off of those medications. So. All
right, you brought in a little display here. Show me where the L5S1 is.
Well, crash course on the lumbar spine. The bottom 5 vertebrae, 1, 2, 3, 4, 5, are the lumbar spine. So if you hear things like L3, 4, L4, 5, they're talking about what particular level things are going on. And in between the vertebrae, we also have the disc, and they're very aqueous. There's a lot of water content in them, which is why we can bend all over. So there's a lot of fluid inside there. So the L5S1 would be the L5 vertebrae, the 5th lumbar vertebrae, and S1, which is the sacrum, our tailbone here, as people commonly understand it.
So this I no longer have. This was just taken out.
Okay, that's why you
spacer and 4 screws put in here. So I noticed you've got a couple of makeshift screws. I know they're not there for that purpose.
Typically, if there's say a disc herniation, the majority of the time a disc is going to herniate backwards or posteriorly, as it's referred to as. And if there's mechanisms that can herniate a disc, forces, repetitive motion, sitting, or picking up something heavy, that can put a lot of force on the front part of that disc and just spit it out backwards. And now you have these nerves that are right behind it coming off the spinal cord. And if that disc is hitting that nerve, that can start irritating the nerve, which goes down the leg. So that's where the numbness sciatica portion comes in.
Sure.
In conservative approaches like physical therapy, we can do some mechanical evaluations to see if we can unherniate or reduce the disc, as it's called, to take pressure off the nerve. If the conservative approaches fail and we can't get that disc off of that nerve and it's healed itself in that position, then you start looking at the surgical interventions.
Sure, but you hear people all the time that have got back pain, that are dealing with sciatica, that sort of thing. So really your recommendation, I would imagine, is come in for a screening and really get started on it before it gets out of hand, right?
Absolutely. One of the things that we do at Randolph Sports Physical Therapy is I offer to the community free injury screenings and physical therapy consultation. You don't need a script from the doctor to come in and get that. Come in if you have an issue and you're not sure whether or not you need to see a doctor or a physical therapist. Give us a call. Our number is 815-462-RSPT, which is pretty easy to remember.
Good, yeah.
Come on in, take 15, 20 minutes, sit down, tell us what's going on. We can do a quick assessment to see, okay, you should follow up with the doctor, and we can provide recommendations for physicians who we work with closely, or say, okay, you may benefit from a few sessions of physical therapy. So we can at least get the process started so people aren't sitting at home wondering should they or shouldn't they.
Well, that's good. Now, are you finding that as time goes on that your practice evolves as well, or has physical therapy pretty much been the same for a long time as far as how you treat patients?
It's always evolving, because with physical therapy we are a very evidence-based practice. We do the interventions, the treatments with patients, because there's research out there that shows, hey, doing this has had optimal results. So this is the new standard of practice. Just like with medicine in general and surgical interventions. Now, surgeons are doing disc replacements, so they're no longer, well, they still do the fusions, but now disc replacements is a common treatment option for individuals. So just like medicine, physical therapy is constantly evolving as well. And there's some pretty good literature out there, especially when you get into the world of sports rehabilitation, doing sports-specific rehab for athletes. Female athletes who may injure their knee on the field. Amateur soccer players, they followed amateur soccer players who have implemented physical therapy based rehab programs, and they did 2-year, 5-year follow-up studies with these athletes and looked at injury rates and re-injury rates, and significantly decreased the amount of injuries by implementing these type of therapeutic interventions.
That's great. So again, like I said, there's so many people out there to deal with pain. A lot of it back pain. They can come to you for a free screening, and in many cases, with some physical therapy and with some lifestyle changes, they could probably eliminate a good deal of that pain without surgery.
Absolutely. And another thing that we like to promote at our facility is patient education. When I explain the spine to you, oftentimes when people have a diagnosis of a disc herniation, I use disc herniations because that's one of the most popular reasons for seeing the physical therapist. Oftentimes people have no idea what the disc looks like, where it is, why are they having sciatica down the leg if the bulge is in the back. And when we bring out the spine model, and individuals can visualize their diagnosis and see, okay, I'm doing this particular exercise because we're trying to facilitate this, then it really helps lead to a very proactive approach in their rehabilitation. So, and once they're healed in physical therapy, if this is something that comes on again down the line, 3-5 years down the line, one of their first lines of defense can be self-management with their education that they've received.
Oh, that's great. Well, you've told us an awful lot about physical therapy and what you do. Anything else you'd like to share with our viewers?
Well, like I said, we do offer the free injury screenings and physical therapy consultations, so you give us a call at any time. We can typically get patients in our door within 24 hours. So we accept most major insurances, including Medicare. So we would definitely look forward to working with individuals.
That's right. Don't live with that back pain or any other pain you have. Come on in and get your free screening.
Absolutely.
No doubt about it. Well, James, thank you for being here today. I appreciate it.
Mayor Baldwin, thank you very much.
Good, and best of luck to you.
Thank you.
All right. I want to thank all of you for watching this edition of Community Business Spotlight.